In this video, I'm going to show you how to quickly relieve a stomach ache. Stay tuned. Hey everyone, Dr. Rowe coming to you from SpineCare in St. Joseph, Michigan. In this video, we're going to go over easy exercises that can instantly relieve a stomach ache. And we're going to do this by stimulating the digestive system and releasing trapped gas, bloating, and constipation, the main causes of a stomach ache. Each one of these exercises works just a little bit differently. To get the best results, go through them all and use what gives you the most relief. With that being said, let's get started. So this is my go-to exercise anytime that I get a stomach ache. It's really easy to do, and the great part is you can do this when seated. The first thing that we're going to do is start with very good upright posture. Just have your back as straight as possible. I know a lot of people with stomach aches, they're going to be hunched forward due to pain or discomfort. Do the best you can to come upright, even if it feels like a really deep stretch forming over your abs. So we're going to hold this position and now do a light massage over the abdominal region to stimulate the digestive system, get a good flow of food and fluid through it that will hopefully relieve our stomach ache. So I'm going to take the meaty portion of my right palm and I'm going to place it right below my ribs off to my right side. Just apply enough pressure in there where it's going to be a comfortable self-massage, not causing any discomfort. And you're just going to do a light circular motion over that spot, roughly about 5 to 10 seconds. And I like to do this one clockwise. So once I've done that, and I've done it for 5 to 10 seconds, I release it, see how it feels. If there's really no discomfort in that area, I just move a little bit more towards the center and then repeat this, and then going all the way towards the left. Once I've done pretty much the whole top region below the ribs, I just move down an inch or two and then repeat this, going over the whole abdominal region from the bottom of the ribs towards the top of the belt line. So when you do this, you're probably going to find that one certain spot is the pinpoint spot of your stomach ache. Maybe there's just a lot of discomfort right there. At that point, I would focus on that spot. Keep throwing repetitions in, massaging that area to stimulate the digestive system to get more relief. So after we've done our massage, the next thing that we want to do is engage the abdominal muscles to hopefully get a lot more relief. This one is called abdominal squeezing. It can be a little bit tricky at first because you really have to separate your breathing and the contraction of the abdominal muscles. So here's a really easy way to be able to do this. What you want to do first is just take a deep breath in and then hold it, and then just squeeze those muscles, kind of like draw them towards your spine. And when you do this, you should feel those muscles get sucked in even further. And then what you're going to do is release it without exhaling, and you're just going to repeat that quickly for about 5 times. So it should almost feel like a pulsing motion. So I'm going to do it right here, and I'll put my hand over my stomach so you can see it a little bit easier. So once we feel pretty comfortable with that, now let's target 2 different areas of the abdominal muscles. The first one is the upper abs right here below the ribs. So I like to take my right hand and I just place it over the top right here below my ribs. And our hand is going to act as a guide. When you do this, really focus on contracting the muscles that the hand pretty much is over. So at this point, it's going to be the upper abs. I'm going to take that deep breath in and then contract those muscles. Again, I try to do that about 5 times, release it. But if it does feel like there's a lot of discomfort in that area, I would throw a couple more sets in there because it's going to, again, improve flow and just hopefully give you a lot more relief. So after we've targeted the upper abs, what we're going to do next is now focus a little bit more on the lower abs. We're just going to take our hand, place it more across the top of the belt line area. Your hand should be over your belly button. So we're just going to do the same thing. Deep breath in, contract those muscles. But again, really focus on the muscles that your hand is over. So after we've done all of that, let's do a couple more movements to really engage a lot more muscles, including the pelvic floor, and help stimulate the flow through the rectum and the colon, because obviously bloating and constipation is a big cause of a stomach ache, and this one can really help out. The first movement that I like to do is just, again, have very good upright posture, and I just put my arms out in front of me, kind of like a genie position, and I'm going to move through my back, twisting towards one side as much as I can until I feel a really good activation over the abs and off to the side into the back. Once you feel that, you're going to hold this for about a second and then just twist towards the other side. Just doing this nice and slowly from side to side for about 15 to 20 repetitions. Afterwards, see how you feel. If it feels like it's helping out, you're more than welcome to throw in another set or two. But the last movement is really going to help stimulate that pelvic floor and hopefully relieve constipation really quickly. This one might get you to go immediately, so be ready for that. What I'm going to do is just a marching motion. I like to take my hands, grab off to the side of the chair for support, and I just march my knees upward towards my chest just like this. Just really focusing on driving that up, engaging my legs, my hips, all the way into my pelvic floor muscles, and you should also feel it in your abdomen. Hold that for a second and just march back and forth for about 15 to 20 repetitions. But again, afterwards, see how you feel. If it feels like it's helping out, you're more than welcome to throw in another set or two. But go through all of these movements. You're probably going to find that one offers the most relief. At that point, keep building into it over and over again. So this is called the gas relieving stretch, and just like the name implies, it's going to help release trapped gas and bloating that may be causing our stomach ache. There's a couple different steps in this one, so let's break it down and make it really easy to do. We're going to start lying flat on our back in bed or on a floor. Straighten one leg out while the other knee is kept bent. Take your hands, cup around that bent knee. Now pull this knee towards your chest as much as you can until you feel a really good activation of the muscles around the hip into the lower back, but it should feel like a light contraction of the abdominal muscles also. Once we feel that, we're going to hold this position and now press our shoulders and upper back and head straight down into the bed or the floor. We should also feel a really good activation of those muscles. So once we're in this position, we're now going to take 5 deep breaths in and then let it all the way out. Once we've done that 5 times, we're going to take this one to the next level by now curling upward like this. So lifting our chest, shoulders, and upper back upward towards this bent knee and also curling our head forward. We're going to now feel a really good activation across our abdominal muscles. Let's hold this position and now take 5 deep breaths in and out. So once we've done that 5 times, we're just going to release everything, take a breather, relax for a second or two, and then just switch to the other leg and repeat this whole process. I would try to do this about 3 to 5 times on both sides, and with each repetition, just try to build into it a little bit more. Again, just like the name implies, this one right here might give you the urge to do a little too. So if that's the case, just let it out, and I hope that this gives very quick stomach ache relief. A main cause of a stomach ache is due to constipation. Everything just gets blocked and backed up. A really easy way to relieve this is by doing what I call the natural pooing position, which is going to help relax and open up the pathway through the colon and the rectum and hopefully get that gravy train flowing. We can do this when seated on a toilet or a chair. You just need a sturdy object that's high enough that you can put your feet up on it like this and have your knees higher than your hips. It's really important that our knees are going to be higher than our hips. So if you're in the bathroom, a small wastebasket should work. You can also use something like a cardboard box or a stack of books. But what we want to do next, once we're in this position, is have very good upright posture. Just have your back as straight as possible, and you just put your arms on your knees like this. Try to relax your whole body. Don't tense any muscles, and just kind of clear your mind. You can close your eyes and just doze off. But what you want to focus on doing is just controlling your breathing, doing deep breaths in and then all the way out to release more tension. And I like to do that for about 30 seconds and then just relax a little bit and then just keep repeating this over and over again for a couple minutes. During this time period, what you're going to notice is things really start to relax, especially across the abdomen, working downward into your pelvic floor. And you might get a sudden urge to do a big, satisfying poo. So if that's the case, just let it out. So here's a really easy exercise that you can do in bed or on a floor to quickly relieve a stomach ache. Let's start lying flat on our back like this, knees bent, have your feet flat, and just bring your heels slightly towards your bottom. And what we want to do first is what is called a pelvic rocker or a pelvic tilt. This will really help just loosen things up across the abdomen into the the pelvic floor. Take your hands, put them right on your hips. Now imagine your tailbone. What you want to do is scoop it forward like this, kind of curling it towards your belly button. As you do this, you're going to start to feel your hips rock, and a lot of muscles across the pelvic floor into the abdomen start to fire. Just hold this comfortably for about 5 seconds, and then what you're going to do is go in reverse. Just take your tailbone right here and now press it downward into the bed, kind of scooping it backward. Again, you're going to feel your hips and your pelvis start to rock, but the muscles get hit a little bit differently. And I like to go just back and forth for about 5 to 10 times, and with each repetition, just building into it a little bit more. Afterwards, see how you feel. If it feels like it's helping out, you're more than welcome to throw in as many repetitions as you like. But let's really take this one to the next level by doing this. Let's bend our knees and then take our arms and cup around our knees and draw our knees, I should say pull our knees towards our chest as much as we can until it feels like our tailbone right here and our butt is just getting pulled slightly off the bed or the floor. We're going to hold this position and now cradle our knees and rock them from side to side. And when you do this, really focus on moving through your hips and your lower back. This is really going to stimulate a lot of things across the digestive system. So hopefully this will just release tight gas, even maybe give you the urge to have a bowel movement. But just keep building into this over and over again for about 15 to 20 seconds. Release it, take a breather, and then repeat this 3 to 5 times. If the exercises help, please support the channel by giving this video a like and maybe subscribing too. If you have any comments or questions, please leave them below. I'll get back to you as soon as I can. Thanks for watching.